Hello, my name is Dr. Andrea Unger. I'm the ER Chief and Medical Director. Everything tonight is about the ER redevelopment and rebuild, and I'm very happy to share with you my feelings about what this rebuild is going to mean to me. I have several thoughts about how beneficial this rebuild can be to our community. One is how medicine has changed and the ER needs to update with the technology and the reality of how we do business as a healthcare system now. The second is I want to talk about how we can do better addressing specific populations with an ER rebuild. And the last is the opportunities that coming through COVID have afforded us and how we can use this to help us create a better emergency room. The current emergency room was not created for the kind of medicine that we do now. We haven't had an update in over 20 years, and yet the technology has changed dramatically. Whereas medicine was done with patients lined up with curtains in between, and now we know that we can actually do so much more for patients. We can afford them privacy and confidentiality. We can afford them space to do the procedures and the treatments that we need. Instead of someone coming in and moving from place to place to place, we know the way to do medicine is to have everything come to the patient. So we need the space so that the center and the most important person is in one place while things come to them. So that might be an ultrasound machine coming to them, a registration clerk coming to them, an IV cart, a catheter cart, any treatment carts, but people coming to them. We need to use the architecture of an emergency department to reflect the way that we want to provide care, with the most important person being in the middle. And right now, the kind of medicine that we do is not based like that. We know we can do it, and an emergency department renovation will take us there. Once the bricks and mortar of the walls and the development is redefined, it's the what goes inside that space that the donors can really help with. So someone who is spending an overnight in the ER right now might be in a hallway, but in a new development, they might be in a private area where you could turn the lights down, where they could get some sleep and some treatment. And the next morning, the home and community care, the navigators, the specialists could come and have a family discussion. And that could be done privately. That could be done comfortably. And that person could wake up in a room and see a clock on the wall and know what time it was, instead of being in a space that's constantly noisy with lights on. The space that we could create, the space that is comfortable, that has chairs, that's respectful, that has a clock, these are the kind of things that donor dollars can do and make a difference. I want to talk about some other special populations like our pediatric population. When they come to the emergency department, they do not need a one-size-fits-all waiting room. That doesn't work for anyone. When you bring a child, you need a fast-paced, quick area where you can go access a pediatrician quickly, access an emergency doctor quickly, and leave, so that that child is not spending time next to other people who are having a difficult time. We want that child to see that we can help them and we can move them through quickly. Having the foundation help create a space where children could be comfortable with furniture that's their size, with a screen that they could watch on to decrease their anxiety, a place where family could meet in private. These are the kind of things that a new emergency department rebuild could afford. There's special populations like our seniors population. Some people come to the ER needing a short respite, some treatment, some time to meet with specialists and organize community resources. This can't be done in a hallway. This has to be done in a dignified place where people can rest, talk, and make plans. We are developing a clinical decision unit, a whole area of the ER, understanding that that's a future state. Not everybody comes here to be admitted for a long time. The hospital is a pivotal point in the community where you can quickly access the help you need. And if we have an area that is quiet, that is properly lit, that has the right features to manage people with dementia, people with crisis, people coming with caregivers, we're going to be able to serve the community better. One of the things I'm most excited about in this rebuild is that we are able to create a space for our Indigenous community members. As we rebuild the entrance to the ER, we're going to include an Indigenous healing suite. This will be accessible for the whole hospital as well as the ER and for any communities that need to use this space. Being able to provide visual and physical space that promotes the sense of welcome is an incredibly important part of what this hospital can do. I want to talk a little bit about the opportunity that COVID has given us. We have done an incredible job as a community responding to this global challenge. But COVID has also shown us the faults and cracks in our system. It has given us an opportunity to have a renovation at the same time as we've seen the limitations. So what we know moving forward is we need to create more spaces that are safe for uncharted challenges. We would never have expected we would need things like so many negative pressure rooms. We would never have expected that we would need to build walls and put in fans and include filters. This was not a reality in any hospital that was built when this hospital was built. So the challenge of COVID has shown us we need to be able to anticipate unexpected. We need to be able to create spaces that can be used in multiple ways, and we need to be able to prepare for a future where we don't know exactly what we'll need, but we have the tools that will be able to pivot and transform for them. A good example of a tool that we used in COVID was our ultrasound machine. This was a donation from the foundation, and many of our ultrasound machines have been donations from the foundation previously. We would never have known that the portable ultrasound machine was the thing where we could make the very first diagnoses of COVID. When people were too sick to go to the X-ray, too sick to go to CT, we could use that portable ultrasound machine in the ER and help improve our clinical acumen and diagnostic ability. So when the foundation donates important technology, we're going to take that technology and use it for the uncharted challenges ahead. It was such a gift to us to have that extra ultrasound. It made an incredible difference directly to patients arriving in those early days of COVID, scared, unsure. We were scared, we were unsure, and we used the technology that came to us from the foundation, and it made the big difference. I have already benefited personally from the equipment that has come from donors. I have been in the ambulance with the transport monitor. I have used the ultrasound machine to diagnose my first COVID patient. The pieces of equipment that come from donor dollars make the difference with the highly professional team doing their job in an efficient way. We make a difference because we use the technology that you purchase for us. If you are able to give a gift of whatever size to this ER redevelopment, know that your donation is going directly to patients in need. It is being used by professionals that need it. It is being used in the most urgent times, sometimes in people's lives. Your donation is important. Your donation matters.